We have also one additional intervention from the floor, Ms. Charlotte Mbuh, who's with the Geneva Learning Center, and she would like to share what they're doing with immunization professionals to also build capacity at national level and subnational levels as well. Ms. Charlotte, I see you. Please go ahead.
Thank you very much, Dr. Rana, and good afternoon to everyone. My name is Charlotte Mbuh. I worked for 10 years in Ebolowa, that's in the South Region of Cameroon, in my country's immunization program. When the pandemic hit, I and more than 6,000 fellow immunization professionals pledged to support one another in the Geneva Learning Foundation's COVID-19 peer hub. You know, most of us are from Asian and African countries working in health facilities and districts. So in just 10 days, we shared over 1,200 ideas and practices that were helping us face the consequences of the pandemic. By the end of 2020, about 2,000 participants had implemented improvements for recovery of routine immunization services. Let me tell you about one of my colleagues, Dr. Frank Monga, a district medical officer in Lubumbashi, that's in the Democratic Republic of Congo. So using only locally available resources, Frank set up a system to reduce missed opportunities for vaccination, aid up with the community to find zero-dose children, peers in neighboring Nigeria and Cameroon, but also from Pakistan and Indonesia performance and strengthened resilience for when the pandemic hit. My peers and I, we learned the value of working globally across boundaries of geography, of role, gender, and health system level. That is why the IA 2030 principles that have been outlined here today are so important to us, particularly leadership by people who deliver vaccines and genuine collaboration across subnational, national, regional, and global levels. That said, my question to global leaders is this: will you support health professionals such as Frank, who opt in to go above and beyond what their job description says, and who are willing to innovate and take risks to make a difference as far as immunization is concerned? Thank you very much. It was an honor for me.
Thank you very much, Charlotte. And you know, I'm sure the answer will be positive because we need people like Frank. We need this kind of work and energy really to move the immunization agenda forward.